Welcome to our broadcast, The Path to Be Well, Knowledge and Learning Session. To all our listeners, we're so happy that you've joined us. And note that you can also subscribe on our YouTube channel or find us on weedwell.live. Now, these sessions are focused on adding clarity regarding cannabis as a treatment option and whether or not it's right for you, and will bring clarity to help you make informed decisions with respect to improving your quality of life. Now, you may know someone that could benefit from this type of information, so please do us and them a favor by sharing this event. Hi, my name is Mark Tremblay, a founding member of Simcoe Holistic Health and Weedwell. I want to share with you how I became involved with cannabis as a medicine. Well, as a teenager, I did sample marijuana and quickly concluded it just wasn't for me. And I will admit that I did find myself judging those who did consume marijuana, thinking that their sole motive was to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. You see, a loved one was diagnosed with MS, and after many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open and my interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. And since then, we have served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families experience improved quality of life. Having said that, I also observed that cannabis treatment is simply not for everyone. And for that reason, I want to caution our listeners that cannabis treatment is not a one-size-fits-all. Determining if cannabis is an appropriate treatment requires the attention, care, and focus of your healthcare team. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. So joining me today is my colleague and good friend, Paul Calori. And Paul, welcome.
Thanks, Mark. Good day to you. How are you today?
I'm doing great, Paul. As we were getting ready, or I was anyways, mentally for this, we all know how quickly time goes by. But in this case, I always wait with anticipation having these sessions. So it seems forever since our last one. I guess maybe similar, maybe a little bit of an exaggeration here, but to Christmas morning for some. But I always look forward to these, Paul. How about you?
Oh, absolutely. We started, now a good month, 6 weeks ago, and we had, I would say, a more solid framework of what we were going to talk about. And that slowly went out the window, and now it's become a discussion. And it kind of leads us off on tangents. I recall last week we got into one of those places, but it's all information and it's all informative for our listeners, and it's certainly things, little points that they can take away. So it is a great time to have conversation. I love where they go. I was chuckling a little bit this morning as you were doing your intro, and cannabis is not a one-size-fits-all solution is right in there. And so we say it, and it's often said, and whether it's this broadcast or some of the other things that we're presenting material to our listeners, to our viewers, we say that. Today's the day we're going to explain that. And so this conversation will kind of take on two parts. The first will be actually explaining why cannabis is not a one-size-fits-all solution. But then the second part is we're going to give you 3 or 4 things, we'll say, and some of them we've already talked about, but we'll give you 3 or 4 things that will maybe help make cannabis your solution. And it'll kind of look like that. So cannabis is not a one-size-fits-all solution. Mark, do you want to start with that one?
Yeah, I'm happy to, Paul, for sure. And and you made the same observation, because we say it so often that it may not resonate with us. It's part of our almost day-to-day lingo, if you like. But again, as I was, saying my opening intro, I'm like, yeah, here it is, embedded right in there. So it is part of, let's call that our DNA, I guess, in some ways. But there is so much truth to that, Paul, and we've all witnessed clients coming to us and say, "Hey, I talked to my friend, and this is working so great for them, and I'd like to experience or being able to benefit from similar relief." So they're coming in with an expectation of finding similar, if not the same type of relief, because the ailments or the symptoms are very much the same. They're expecting that the relief will be the same for them. And we know, and we have observed, that that is not always necessarily the case for a number of reasons. And I'm going to say this to start this off, Paul, because we do know that patients respond differently to various treatments or therapies. And I'll use one example that I am very familiar with, and that is Gravol. For most people, that will sedate them, and at times been used just for that. Well, I remember where I needed to sleep, and I figured I'm going to try Gravol because everyone tells me that it works. I'll tell you, Paul, my experience with Gravol was like overdosing on caffeine.
Uh-oh.
I felt like I was going to bounce out of my own body, honestly. So, this is many, many, many years ago, but those experiences you never forget. It could be a little bit of a stretch or exaggeration, but I think it's impactful in really making a point to say that people do respond differently, even to over-the-counter things like Gravol. So, Paul, over to you.
Yeah. So you've touched on the, really good point. I like to think of it as the why not me crowd. So I talked to Bob, I talked to Joe, it worked for them. Why not me? And so sometimes it's just a matter of time. So it's not that it won't work for you. It's Bob or Joe or whomever you talk to had a response within weeks, and we've mentioned before, there are some individuals that it will take place over months, and so when we talk about some of the tips that we can do to make cannabis your solution later on, we're going to bring up that exact point. So sometimes it's just a matter of time. Other times, and you touched on this as you introduced that, is we tend to categorize symptoms in large categories. And this comes from our patients too. It's not just us. I am suffering from anxiety. That's a big category of potential symptoms or triggers. I suffer from chronic pain. That's a big category of where's the pain, how long's the pain been going on for, et cetera, et cetera. And so while we have similar words in description of the symptoms may not be exactly the same. Hence, your response to treatment using cannabis may not be the same. And so that's something else to keep in mind. The symptoms they might sound similar, but they don't exactly line up. And so your response might be different.
Yeah, very good point, Paul. And the source of that pain, right? What is it coming from? And I'm sure, you'll elaborate on that more, and that's why for someone, pain is pain, but where's the pain coming from as a result of what? Is it inflammation? Is it an injury? Is it a pinched nerve? Those sorts of things. And medicines, including cannabis, will respond differently, and in some cases not even be effective in some of those cases.
Yeah. That's a great segue, Mark. The types of pain that you just mentioned, whether it's a nerve pain or neuropathic pain, to be technical, I guess, but a nerve pain or pain from an injury or pain from an inflammatory process, will segue into strains. And we found certain strains, i.e. CBD or THC over time, may be better suited to treat this type of pain versus that type of pain. And so while we use the term medical marijuana or medical cannabis, that's a big category, but there's literally tons and tons and tons of strains that seem to be suited towards, in this example, one type of pain versus another.
Yeah, exactly, Paul. I'm liking where this is going already, and we're still on target and on point as far as the conversation goes.
Yeah.
And the topic of today's conversation, it is fairly broad, so I guess it's fairly easy to stay within,
Yep.
that framework or the boundaries that are there. If we can use a recent example with the client that we did an interview with, and other clients, where this gentleman in his 70s was in a lot of pain, a lot of discomfort, but because of his background, was able to do a lot of research even prior to, and it really set a treatment plan for himself. And that's not typical, as you know, but the point that I want to make here is that for him, the results were almost immediate, like within days. And that could be the envy of many. Well, I'm not saying that his preparation, his research, the way he introduced it to his body, along with other things, it was the answer to everything. His body responded well to the treatment, combined with, call it, the structure that he set for himself, all attributed to the end result. Where others, body may not respond the same, or the treatment plan is different, where they tend to want results quickly and try different things really rapidly, where, we always suggest start low and go slow, listen to your body, those sorts of things, and make it an incremental thing or journey where you start with something and monitor the results and build on that to position yourself, for success over time.
So if you're able to do some research beforehand, we've talked before about empowering the individual, empowering the client, and coming in with some information is going to empower you. And whether it's your own research or joining chat boards or groups, the past Weedwell being one, where you're sharing ideas and thoughts that others have gone through, and at least it gives you an idea, because for some people we meet, they don't have an idea of where to start. And so just having a starting point can already, we'll say, propel you down your path. Whether or not that treatment actually works, well, only time will tell. Something else you mentioned as slight differences in treatment plans. We've talked about strains and how they play into how someone might respond to treatment, but also the method of consumption. And we've talked before lots of times about the 4 main methods of consumption of cannabis. Well, it's another, we'll say, X factor in how you may respond to a cannabis treatment versus myself versus anyone else. You might swear by drops under the tongue, something we call sublingual dosing, and it works for you, and you love the long-acting action. And I might say, Mark, that's never worked for me. I don't find the benefit. But you know what? When I have pain during the day, I'm able to take a few minutes to myself, inhale some cannabis for the quick acting action, and I feel much better, and I'm having successful treatment that way. And so it's really important to take into consideration when you say treatment plan, along with type of cannabis, how you're consuming it.
Yeah, very good point, Paul. And who's kidding who? We live in a society, a drive-through society. So we're out doing running errands, and we have this hunger pain come on. What do? We find our favorite drive-through, and we call it a quick fix. And we also live in a I want it now society. We're surfing online. We want the results and the answers right away. We order something. We want it at our doorstep the same day. So that's kind of the mindset. And obviously, in that mindset, we're expecting quick results when it relates to our health or improving our health as well. So going back to start low and go slow, any preparation work that can be done ahead of time can be beneficial. Now, to that, I would also caution our listeners that some of that information that is available, as we all understand and know, online, it may not be appropriate for you. And we always encourage, professional medical help. So your family doctor, anyone that fits that circle, and maybe it's my colleagues at the clinic. But so yes, there is good, valuable information, but be able to discern if it's legitimate or blown out of proportion.
Yeah.
And always, go back to your reliable sources, I guess is the point I'm trying to make here.
For sure. So the idea that cannabis not being a one-size-fits-all solution, I'll just change course for a moment here. The last thing and the most obvious thing that we should mention is genetics. And so we're all wired and programmed differently. And so it stands to reason that the stuff that goes into our body, the medicines that go into our body will react differently. And unless you have a clone, you wouldn't expect the exact same results. You'd expect similar results.
Mm-hmm.
Mark, you've already touched on, I think we've covered what and why cannabis isn't not a one-size-fits-all solution. You've already touched on a couple of things, though, to help cannabis perhaps end up being your solution. And, it's a very important point where you talked about research or having some background in consulting with your doctor. But something you've touched on and something we preach all the time is start low and go slow. Do you want to elaborate a little bit more on that one?
Yeah, especially if cannabis is new to you, as we've said a couple of times already, your body, we're not sure how your body will respond to it. And along with the start low and go slow, we usually follow by saying, listen to your body. So when you're starting with low dosages, really listen to see if your body is telling you something, whether it be positive or is this going in the opposite direction. And if it's positive, give it a couple of days and then build on that, and so on and so forth. If it's negative, look at what you've done that day or the previous day and maybe correct that course slightly. So those are kind of baby steps. And those are the areas where, as required, anyone in our team can help in our Ask Me Anything live sessions. Monday nights, here's a little plug, Monday nights at 7, and I believe it's Tuesdays
at 11.
So look for those, and those are great opportunities to join either Paul or myself with anyone else in a group setting that have questions. And we find the group settings valuable in that patients, when they ask a question, there could be someone else listening saying, oh, I never thought of that, but I'm finding that interesting. Yeah. And I could learn from that as well. So that's my little plug for the Ask Me Anything or the AMA sessions.
Perfect. So to your 2 points, the start low and go slow and starting to listen to your body. Excellent points. And it's something that individuals can do with any treatment. We're relating it to cannabis today, but that's an important skill, the listening to your body and what it's telling you on anything that you're introducing new, whether it's a treatment, an exercise regimen, therapy. Your body's going to tell you its response to that. What I would, kind of continue in, and it's a discussion we had before, is health journaling. And so it's great that you have the recognition. My body feels a little bit better. My body's not feeling, as you pointed out, it could be positive or negative. My body's not feeling as well. But we want to document that. And typically we'll remember what happened the previous day or the previous couple of days. I don't want to go into a whole health journaling discussion. We've already done that. But being able to recall over a longer period of time, and one way to do that is write it down, gives you trends as far as how you're feeling in a positive way or a negative way. But it also dictates, when we say start low and go slow, adjusting the amount or the type of medication going forward. Excuse me. And so that journal serves as a template to circle back around to, can I go a little bit faster using the start low and go slow? Can I go a little bit faster, or do I need to change something up?
Yeah. Yeah, for sure, Paul. What else is coming to mind, and it lines up with cannabis is not a one size fits all for all the numbers that we've talked about, or all the reasons that we talked about, rather. And I know, Paul, you'll be able to recall this story as well. Again, this female lady in probably late 70s, early 80s came to us so excited about getting cannabis treatment, in this case CBD, for her arthritic pain, because someone in her bridge club said it's working amazing for her. So she came with an expectation of being able to see similar results. And here's the key, where it's not a one size fits all. It was discovered through a process with our doctor and the pharmacist that there was a significant interaction with the medication that she was on. So she left her appointment not even being prescribed. So it's kind of the other example of it's not one size fits all, because there's so many variables, and the medication that a patient is on today could respond in a positive or non-positive way to cannabis treatment. So, another example of the variables, in addition to those that we've talked about already. Now, fortunately for that person, through the help of her specialist, the pharmacist, and our doctor, was able to find a substitute medication that would not interact with CBD, and was eventually able to undergo the CBD or adding CBD to her treatment. But it just shows that it's not a one size fits all. This is not cut in stone. It works for everyone, and you can expect these kinds of results.
Yeah. It was an excellent approach on that story that I see, because it goes back to do no harm. And so if you know that something bad can happen, might happen, will happen, it's not going to be for you, or we can look to something else to substitute, as you said. Just as you said substitute, it made me think of something. As we see patients commonly trying to substitute medications, whether it be antidepressants, anti-anxiety pills, sleeping pills, pain pills. Those, I think, are the 3 or 4 most common ones we see. And we just want to introduce a concept of, we'll say, keep it simple. And a lot of times we've said, put on the brakes, just stop everything you're doing. We've talked about that in terms of be clear and the health selfie and stuff like that, but it still carries on into here. And what we see is people that want to start cannabis day one, but stop their sleeping pill, stop their antidepressant day 2. And that's just not, well, it's not appropriate. And in some cases, it can be quite dangerous. Some of these medications take a weaning off process to be able to do it properly and safely for your body. And that should only be done with the assistance of your prescribing physician. That concept, though, ties into keeping it simple or simplifying things, because if you actually did that, let's say hypothetically it was safe, but if you actually did that and you started cannabis at the same time, and let's say you had a positive result, there would be no way to tell if the positive result was the lack of medication, we'll say the pharmaceutical, the introduction of cannabis, or any other variable. And so keep things simple so you can really pinpoint the cannabis is acting in a positive manner. It's not helping me. And it allows you to adjust accordingly on the go, which is what we promote. This is the start low, go slow, listen to your body approach. Well, if you can pinpoint things by keeping things simple and we'll say as stagnant or as normal as possible, especially as you introduce cannabis, you're more likely to be able to pinpoint exactly what the cannabis is doing.
Yeah, very good, Paul. All good points for sure. What's the next step or item or topic?
I mean, I think we've covered the cannabis as not a one-size-fits-all solution. I think we've covered the 3 or 4 things, with start low, go slow, listen to your body, keep things simple, make sure you document how you're feeling in a health journal. Those are the 3 or 4 things that really, it doesn't promise you success, but it can help you down towards the path of success, hopefully. You've related it in terms of pharmaceutical world. The idea that cannabis is not a one-size-fits-all solution with your gravel story, and I think that's very important. And we see that with different types of medications as well. And this is why, you see 2 people that might be on a certain type of medication, whether it's a blood pressure medication or a heart medication, and they're 2 totally different names and they work in 2 totally different places. Well, that's why one would work for one person and one would work for another person, but in different ways, even though they end up having the same product or the same result. And so your gravel example, although it was probably a horrible few hours for you, really highlighted that. So the bones of the conversation we've covered. Is there anything that you'd like to add?
Yeah, well, Paul, I just kind of, in a subtle way, wanted to wrap this up. And I don't mean we're coming to an end, but kind of put it all in a bundle, if you like. That, correct me if I'm wrong, but, the topic of cannabis is not a one-size-fits-all is in our area of be informed, correct? In the path to be well. You're the guru behind that, so feel free to correct me here, Paul.
I'm going to say it's in be aware, Mark.
Be aware.
It's okay.
I knew I was stepping out here, Paul, and
okay.
But the thing I had going for me is I had the first word right, be.
Yes.
B-E, right? Be aware, be informed.
Yeah.
Yes.
So,
Paul, why don't you kind of use this to springboard and tell us a little bit about the path to be well?
Okay.
So the be aware and all of that good stuff.
Yeah. So week to week, we've for those following us, and thank you for following us, we've kind of bounced around, and we've mentioned this is part of Be Progressing, or this is part of Be Clear. There's actually 5 B's, if you will, and so if we'll do it in order, so to speak, we would start with Be Clear, all about creating a health selfie. And so we use things like your experiences, your medical history, your medications, really just how you feel. And this is the slow things down, and just get a handle of where you've been and where you are today, and paint that picture, hence the term selfie, your health selfie. This comes into be aware, which is where we are today. And we talk about things like medical conditions where cannabis may fit in or may not, as your intro suggests and is right, where it might fit into your treatment solution or treatment options. And this all leads us to creating a SMART goal, which was one of our first conversations shortly after New Year. And we related it as a New Year's resolution, but we'll say with superpowers. So that's your SMART goal, and that's kind of what you get when you go through Be Aware. This leads us into Be Informed, and Be Informed is in the Path to Be Well where we really talk about cannabis, and specifically the parts of cannabis. So CBD in terms of how it might help inflammatory type pain, or THC, how it might help pain but has positive sleep properties and things like that, which will bring us into terpenes and stuff like that, other smaller components, we'll say, of cannabis. We also want to talk about how it gets into your body. We touched on that a little bit today, how different people react to different methods of consumption, whether it's putting it on your skin topically, whether it's inhaling it through a vaporizer or a traditional smoke. Not that we promote that way, but it does exist. Or sublingual under the tongue, or even eating it through capsules or brownies or gummy bears and the like that's out there now. We create a treatment plan. Another concept that came today, that's the goal in the Path to Be Well from a Be Informed standpoint, is to create a treatment plan. And so we move into Be Progressing, and now it's time to start treatment and evaluate treatment. And this is, where health journaling comes into play, and listening to your body, and really honing in on how things are going or not going and adjusting. Finally, Be Well, our last big area is all about comparing and contrasting your health journey. And so you took a health selfie, we'll say today on February 25th. At some point in the future, you want to revisit that health selfie and figure out how it is the same, different, and is different better, or is different worse. And so we're going to compare and contrast aspects of your health journey to where you are in we'll say, the future self, your new today, which just becomes really your new health selfie, and you'll springboard from there again. And so it's really just a revolution, a revolving process where you're always moving along your path to be well. You're always trying to aim to improve your quality of life, make your path better, so to speak. And that's the path to be well, in a little long-winded response.
Actually, I would not suggest long-winded. I would suggest very informative. Now, to our listeners, if you're a little bit like me, where retaining some of this stuff is not so easy, and it was quite a bit that Paul did share with us, you could go to weedwell.tips, where there's a good summary of everything that Paul talked about, the 5 Bs, if you like. And if you feel so inclined, weedwell.tips is a good place to go to and really get a good summary with some illustrations and some good support for what Paul has already shared with us. So thank you for that, Paul. When it comes to cannabis, I think something worthy of touching on right now as well is to ensure that the cannabis that patients or clients are consuming, that it would be from a known and regulated source, because we could try to guide them and remove some of the unknowns and give them some steps to start low and go slow and all those others that you've shared today. But to throw in something in there that is not regulated, that is not consistent, regardless of the steps and the journaling that you do, if your cannabis source is not from a regulated source, do you really know the composition or the makeup of that? And how do you build with those baby steps with something that can change considerably from time to time?
Excellent point, Mark. And so, in Canada, we'll use a Canada-centric approach right now. Those are our licensed producers, the companies, the entities that are allowed to produce and make the cannabis in the different forms that you see. And this goes for the medical market, we'll say, and the adult use market. So whether you use your own provincial stores and whatnot, but we know that they're subject to testing. And so that's twofold. It ensures what's on the label is in the product, and the other part is what shouldn't be. The list of we'll say banned substances don't find their way in there. With regards to the States, often I'll read about companies, this isn't the best word, but we'll say subjecting themselves to third-party testing. And so it's not like their own lab and it's someone else doing the testing to ensure those exact same factors. What's on the label is in the product, and what shouldn't be in the product isn't in the product. And a lot of them will actually advertise, these companies will actually advertise, yep, check our lab results right here. And so you can feel good, to your point, Mark, you can feel good to what you're putting into your body is going to be what it says it is, and that it's safe from substances that shouldn't be in there, pesticides and things like that, point of view.
Yeah, very good, Paul. Thank you for that. So, Paul, as we sort of wind up here, what would be a summary of what we talked about and closing comments, if you don't mind?
Don't mind at all. So cannabis is not a one-size-fits-all solution. We've always found it catchy. We mention it a lot. We've talked about why in terms today of your genetics, how you consume it, what type of cannabis you consume, and the slightly different variances in a large medical condition, but specific symptoms that just differ a little bit as to, really we'll say the four main reasons why it just isn't going to work the same for everyone. We did flip partway through, and we mentioned things that, as opposed to it not being your solution, could make it more likely to be your solution. And it started with your comments about start low and go slow. We talked about in terms of time. Sometimes it's just the amount of time, whether it's hours or days for someone, or weeks or months for someone else, where they really begin to respond. And so that might have to do with the start low, go slow, and exactly how much you're ramping up or adjusting your dosing. To the points about dosing, figuring out the right method of consumption for you might increase the likelihood of a successful treatment. Whether you gravitate towards inhalation, you might find that doesn't work for you, and you actually need to do the drops underneath the tongue as an example, or vice versa. But finding out the right method of consumption for you and what your body really reacts to might increase your chances as it being your solution. And so we talked a little bit about self-awareness and journaling. I kind of put that together as being things, listening to your body and documenting what your body's saying to help get to a positive solution. And finally, we talked about keeping it simple. Don't change a bunch of things all at the same time, because you won't be able to identify what's working for you or what's not. Keep things simple. It's a long road. You've been probably sick or ill for a long time. And the fast drive-through society that you mentioned, Amazon next day delivery, that type of thing, it won't necessarily resonate with your health, and you might just need to take some time. So keep things simple. You know where you want to be. Don't change too many things at the same time. And hopefully those 4 or 5 things will help make cannabis a more likely treatment option for you.
Paul, excellent summary, and thank you for that. And trusting that our audience, feels the same way. Again, Weedwell.tips is a good place to get an overview of a lot of what we talked about today. So, Paul, thank you so much for joining us. I've enjoyed this time. I'm believing that our listeners, our audience, feel the same way. And I look forward to doing this again real soon, Paul. So I will complete now with my wrap up. So I'd like to just point out to all of our listeners that the information sessions are intended for individuals who are in generally good health, are generally well adjusted, are functioning effectively and are not in need of medical treatment, including mental health disorders. These information sessions do not involve the diagnosis or treatment of any medical or mental disorders and does not prevent, cure, or treat any mental disorder or medical disease. Further, these sessions are not a substitute for therapy, counseling, psychoanalysis, medical treatment, substance abuse treatment, or the advice or services of a medical professional. It is our responsibility, it is your responsibility rather, to seek independent guidance from medical professionals to the extent necessary. So please do speak to your healthcare provider about the appropriateness of cannabis as a treatment option. And for those who have taken some steps in improving their quality of life, to you we say congratulations. Remember, your journey is your journey. And as long as you're taking some steps forward in improving the quality of your life, you should be proud of the progress that you're making. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. So on behalf of Paul, our team at Weedwell, those in behind the scenes, we look forward to the next time that you join us. And until then, be well. Thank you for joining me. I'd like to take this time to share with you how I first became interested and then involved with cannabis as a medicine. My name is Mark Tremblay, a founding member of Simcoe Holistic Health, Ontario's first medical clinic dedicated to the treatment and care of those patients considering cannabis as an option. As a teenager, I did sample marijuana and quickly concluded that it simply wasn't for me. I'll admit I did find myself judging those who did consume weed, thinking that their sole motive was strictly to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS. After many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand how cannabis can help alleviate symptoms and improve sleep. My eyes were open. My interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. Since then, our clinic has operated under 4 Health Canada regulations and served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families who experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. As we continue to grow and expand our reach, Simcoe Holistic Health is rebranding to Weedwell. For more information, visit us at weedwell.com or follow us on our social channels. Till the next time, be well.